is worth. This is Ability in Disability. I'm Angela Ekure. Do not neglect your mental health. Take care of your health. It's as important as your physical health. Today, I have a special guest sitting with me today. Nurse Marilobi, welcome to this program, Ability in Disability.
Thank you. Thank you.
Good. Therefore, I would want you to introduce yourself.
All right, viewers, good morning from here. I am Nurse Mary Love Chimekwene from Community Mental Health Unit of Public Health Department from FMC Asaba, Delta State here. Thank you.
Wow. Today we're going to discuss about mental health awareness. What is mental health?
Okay, in a layman's understanding, mental health is about your social, your psychological, your emotional well-being. It's all about the way you act, the way you react to issues, your feelings and all that. But WHO gave us a standard definition of mental health, which they defined as the well-being of an individual, whereby the individual realizes his abilities and capabilities, is able to cope with normal stresses of life, the person is productive and fruitful, and lastly, the person contributes to his immediate family, community, and the society at large. That is the WHO's definition for mental health.
Yeah. Wow. What are the scope of mental health?
From that WHO definition, we can see about 4 scopes or pillars or components of mental health there, which include 1, you realizing your abilities and your disabilities. That's what is it that as an individual I am able to do, and you know quite all right that you can do this and you believe in yourself and you're able to do it. It's also your ability to know the things that you're not able to do and accepting that you can't do this. You know, sometimes when I go for talks like this, I ask people that, sorry for using politicians as examples, but then majority of them will come during campaign periods. They will tell us, we will do this, we will do that, and all that. Mm-hmm. And at the end, they are not able to do it. So I begin to ask whether they are actually mentally healthy. Yes, but if by virtue of the allocation they get from the federal government and they are able to do some of these things and still they don't do it, which means they are able to do those things. They can, but they are not doing it. So they will not have to tell us whether they are actually mentally healthy. Then the other aspect or component or pillar of mental health there says your ability to cope with normal stresses of life. Okay, you know, there are things that they must come. You must lose your loved ones at a particular time or the other. Some people may lose their businesses, like we are talking this year, mental health in catastrophe and emergencies. Some people may lose their shops, their livelihood, their farms and all that, which they have actually put in their best, anticipating to yield or get increase. But when they lose some of these things, your ability to cope and bounce back, telling yourself, I will not die because I lose something like this, that is another pillar of mental health. Then the third one, being productive. You have to be productive, right? Okay. And fruitful in whatever you do. You know, sometimes some people are just good in we want to do, but are you actually looking back, asking yourself, these things I'm doing, am I actually making headway? Am I actually fruitful in it? Or you are just, the day will come, you bath and you move out of your house and you're going for businesses, you don't even ask yourself, are you actually making headways? So then your resilience, telling yourself that no matter whatever, I will be able to cope, I will be able to make it. Then another aspect or pillar of mental health is the Fourth aspect from the definition that WHO gave us, which is you contributing, being able to contribute to your family, to your surroundings, and to the society at large. Now, this contribution, I mean, when we want to talk about contribution, let me use myself as an instance. I am a nurse. What am I supposed to contribute to my immediate family, then to my community? Ideally, I should give them health talk. There are some certain things when they want to do it, I tell them, no, don't do this. It's going to harm your health. Then, as a journalist, what is it that you're supposed to do? Are you actually contributing? Like I use our politicians, the things they should do to their immediate constituencies, are they actually doing it? So these are the areas that you look at, and when you are balanced in all of this, you will actually tell yourself that I am mentally healthy. But when you're not demonstrating all these components of mental health, which means your mental health need to be looked into. Yeah.
Okay, so can one demonstrate all these components of mental health?
Of course, you can. Like the components that we have mentioned.
Okay.
One there said that you knowing your abilities and your inabilities. What is it that I know comfortably? Now, if you tell me to run from here to there, of course I know I can. But when you tell me to do that and I tell you, I beg, I no get strength, I no fit do them. Let me say, I'm not really okay. All right. Then it's your ability to know what you can do and do it at the right time. Okay? Then the other one, coping with normal stresses of life. It is not only you that is facing it. Like I think on 2nd of this month, I told people at the Federal Secretariat when I went there to give them talk on mental health, that as far as you are a Nigerian, okay, it is #1 problem that you have to answer a Nigerian because of the hardship in this country. But when you now begin to take it personal, you go to the market, you begin to quarrel with people. Probably you went to the market last week, you bought a penta of Gary, 2,000 naira. Today you came to the market and they are telling you that it's 3,000 naira. You want to fight everybody. Is it not what I bought 2,000 the other day, this one, that one? No. Everybody is passing through that. And there is no how you come to the market, they will not tell you that because it's you, because you can't cope. Now the rice that we're selling 70 naira, we're going to sell it 20,000 for you. It's not possible. So it's just for you to actually know that when this type of thing comes up, yes, it has happened, it has happened. What am I supposed to do? Now tell yourself, I will live. Yeah. So it is really possible that we can apply all these components of mental health. Being productive, of course. You are a worker, you come to work. Are you actually doing what you're supposed to do? Are you going to work at the right time when you should go? The things you're supposed to do. Some people, their files will be piled up in their offices. And people are waiting to get responses. Because they have not worked on the files. Which means you're not actually productive. You're not doing what you should do. Some will even want you to come and tip them before they do what they're supposed to do. So it's actually not showing that that particular person is mentally healthy. Wow. Yeah. So then in terms of contribution, more you know that yes, I can do this and I can actually help someone around me, and you're not doing it in order to make that person happy. You want to cause the person to be in pains. We call them sadists. They will be happy when they see people suffering. So when you are not doing those things, which means you are not mentally healthy. But if you actually know that I can do this and you're doing it, of course, it's very, very possible that we can actually imbibe with the components of mental health.
What is the importance of mental health?
Of course, from our definition of mental health, you should know that it is very, very important in the sense that it's all about your well-being. It's all about your emotions. It's all about your connectivity. How do you relate with people? Okay, it's very, very important. And then when there is an issue, are you able to cope? If you're not able to cope, you can speak out. Let the people that can help out. You know, I know some persons, when they encounter troubles, they will say, I want to be left alone. I don't want anybody to tell me something. I don't want to talk to anybody. You even call them, either they will put off their phones or put it in silence so they don't know that someone is calling and all that. No, the importance of mental health is you now have encountered this problem and I am not going to be there forever. Speak up, and then you knowing that I should contribute to someone's happiness, you're doing it. These are important of mental health. By the time you know the components of mental health and implement it in your daily living steadily, not today you say, after all, I did it yesterday, I'm not going to do it again today. You know, I think you being mentally healthy has something to do with our relationship with God too. If you are a child of God, it may not necessarily be that you're a Christian, you can be a Muslim, you can even be a traditionalist, but knowing the right thing and doing it shows that you're mentally healthy. So these are the importance of mental health. And if you are not mentally healthy, of course, it will be very difficult for you to relate with individuals, even from your own immediate family. To be a very big problem.
Wow.
Yeah.
Disability. How can one improve his or her mental health?
Wow, a very nice question. You know, when we talk of improving mental health, you know, like every year we create awareness for mental health, and one of the yeah one of the major things we do is to make sure that the stigma attached to mental problem is reduced.
Okay.
You know, so the areas you can actually improve your mental health. One, take care of your physical health. You know, I tell people your mental health is as important as your physical health. You cannot be having fever since two weeks, and you're having fever persistently, and you've not done anything about it. You've not even gone to find out what's actually the cause of this fever, all right? Or you tell me you've been having headache. You've not even gone to check your BP to know whether your BP is in order or not. You don't check your blood sugar and all that. So you have to, first of all, check and know that you're physically healthy, okay? Yeah. Well, that is it. Two, you have to eat well. Eat the things that are nutritious, not consuming alcohol, not smoking and things like that, or junks, right? Eat well. And I tell people it's very, very important for you to take those fruits or the food that help to reduce dementia. And research have told us that some food like vegetables, your nuts, cashew nuts, and all the nuts, right, that they reduce the progression of dementia. Dementia, that's degeneration of brain cells. You know, all the other cells in the body have a way of growing and renewing, but those of the brains can't. That is why you see adults, 80 years person behaving like a child. That is because dementia has set in. Then you have to as well connect. Make sure that it's not just on phones. This physical connection is very, very important. Some persons, they can stay indoors from morning till night pressing their phones and gadgets and all that. It doesn't help. Sometimes come out, mix up with people, have connection with people. It has a way of boosting your mental health. Then I told them on second at the Federal Secretariat. In fact, we even did that practice that day. I told them to always smile.
Wow.
Yes, smile. And we did that practice, and majority of them said I should give them something. That thanks be to God, whenever I go for that type of program, I usually go with sweets. Okay. So if I ask you a question or you do something for me, I throw sweet for you.
So what do you have for me today?
You are the one to give me sweet today. All right, so I actually told them that it's very, very necessary. Okay. You frowning your face always does not make you a very serious human being. No, but from time to time smile. Well, because the muscles you use in smiling are quite smaller than the ones you use in frowning your faces. And when you smile, you tend to look younger than your age. But when you frown, you look older than your age. Yes, it's very important. So another thing is being grateful. Grateful. Science and research have told us that those that practice gratefulness, that it eases their stress, and they have a way of understanding the moment. So sometimes, like, I think I have to bring you what happened in my church yesterday. The priest told us about being grateful. Being grateful. There are some persons, when you give them something, they will look at it and say, so now you want me to come tell and thank you because he give me 2,000 naira, because he give me 20,000 naira, upon all the whole money when he gets, upon all the whole houses and all that, I get 5 million naira problems, just giving me 200,000 naira. No, you got to be grateful. When you are grateful, it helps to boost your mental health. Then your exercise. You know, some persons are dormant, especially women. I'm sorry, I don't know who is watching us from wherever you're watching us. You may be a culprit to that. You have your phone there, you're calling Amaka that is at the other side to come and give you the phone. You need to drink water, the cup is there, the water is there, you have to call someone to come and give it to you. These are small things that we need to do to exercise. Then I think I talked about this also last time. Some persons will come to church. Majority of persons, it's only on Sundays that they go to church. And the choir people will be singing and dancing. They are just standing like Yuroko. They know they do children thing. Anybody that is dancing and clapping, that one is children thing, they don't do it. So they think that is a big man attitude. No, you clapping when people are clapping, dancing when others are dancing is a very powerful exercise that we do not even know about. It's not necessarily that in the morning you have to start running from your house to other side. So these are small things that you do to boost your mental health. Yeah.
Wow. Be grateful, exercise. Yeah. Wow. Let's go for a short break. I'll be right back.
All right.
You're welcome back. Disability and Disability. Here with Miss Mary, Nurse Mary Love. Well, we're talking about mental health awareness. Ma, what's the difference between mental health and mental illness? Briefly.
Yeah, I think it's very necessary because some persons, I love this question very well, because actually some persons are mistaking mental health problems or issues, they mistake it with a mental illness, right? When we talk about mental health issues, like from our definition, if you're now finding it difficult to cope with your normal stresses of life, or you're grieving, of course we have stages of grief. You lose your loved one and it's very difficult for you now to pass through the stages to reach the last and accept it, which means you're having mental issues. But when we talk of mental illness, that's where we now have all that psychiatric problems like schizophrenia, psychosis, mania, and all that. Those are the ones that we have their causes, which genetic factor is in fact one of the major causes. But when we talk of mental illness, mental health, mentally unhealthiness, it could be your inability to sleep well now as a result of stress, as a result of bad news, as a result of what you have lost. Like this year we are talking of having access to mental health in catastrophe and emergencies. Maybe you've encountered one or two of all these problems and you are finding it very difficult to cope, all right? Or maybe you've been diagnosed of one disease condition or the other. Like in my unit now, community mental health unit of public health department, that is what we focus on. Some patients may have cancers and they've been diagnosed that the only solution is that they're going to have mastectomy, that's surgical removal of their breast. You know, as a woman, I think our breast is one part of the body that we admire so much, and that is why after sewing clothes for us, we go to the mirror, we stand there, we look at ourselves and see how good or beautiful we are looking. But when you now tell a woman you're going to cut her breast, of course that woman has started developing depression. That is why they are concerned. In my unit, you have to follow them up, right, before and after the procedure. Then some people you tell them, because of this accident you have, we are going to amputate one of your legs, and this is someone that loves wearing his or her shoes and walking elegantly. Of course, you know that that person is going to have some issues. And then for some that maybe they have cancer of any kind and they are going through chemotherapy, and one of the side effects of chemotherapy is immunosuppression, and this one is an outing one, and now you're telling this person, because of your immunosuppression tendency, you're not going to be mixing up with persons, so it's going to bring about the mental unhealthiness, not mental illness. Yes.
Wow.
So
wow.
It's a two different things.
Yeah, two different things.
Yeah.
Wow.
Yeah.
But the word is Community Mental Health Awareness Week. What is the reason for the commemoration, and what do you have to tell our viewer?
Yeah, every October, specifically on the 10th of every October, though throughout the month of October and part of May is usually Mental Health Awareness Month or Week, what we primarily do is to create that awareness, making people to understand that there is something called mental health. It's not only your physical health, that your mental health is as important as your physical health. If you can seek medical help when you have maybe hypertension, when you have diabetes and all that, so you're also entitled to have access to mental health services like your counseling and all that. And this year we are talking of mental health in catastrophe and emergencies. So those people that you encountered problems out of emergency, you did not plan, you didn't know you are going to have this, and it's weighing you down. We are calling on you. You're not in it alone. So we are here to, one, reduce the stigma attached to mental health, and then create more awareness, and then calling on our government to help us out. Like on Friday, I think one of those questions came up when I was at Trend FM. We are calling on government to please look into the matter of the mental health professionals. In this country, we have limited number of psychiatric or mental health nurses and doctors. And even the few that are in the field, the other people stigmatize them. There was a time in life that my name, anytime I passed, that's psychiatrist. That's what they used to call me. You know, to me, it's nothing to me because I know that that is who I am. But to them, they call it, they think they are using it to maybe to reduce my personality or what, because they do not understand. So that misconception about psychiatry and mental health is there. So we are calling on the government to please, if they are doing anything in the health, they should concentrate more on mental health. I think when they begin to put more funds in mental health programs, it will help others that do not want to have anything with the mental health to come in, and it will help us to have more specialties. We have so many nurses that have graduated. None of them want to go and specialize in psychiatry and all that. But if they can boost their fund, if they are actually given any at all, and make the services accessible to people, it will help us. That's our target of this period.
Please, that's a celebration, that's the aim of community mental health.
Yeah, yes.
Now, shortly, disability and disability. What do you have for those living with disability that facing mental health issues?
Right, like I said, you having one kind of disability or the other does not make you a less human being.
Okay.
It doesn't make you a dependent on another person's. I love when I see people that have physical challenges doing one thing or the other. Example is you, my friend that is sitting beside me. You know, some persons think that maybe when they are having one physical challenge or the other, the only thing they can do is to start staying on the road, begging and all that. No, no. There are so many persons that they are crippled. They have one thing or the other doing that you can't even do without calling them. In fact, I have one. My younger brother had poliomyelitis. He started walking after birth around 8 months, but today he's not walking again because of poliomyelitis. But he's presently the SSA to the governor of Imo State till tomorrow. So you can't belittle yourself because you have one physical challenge or the other. So I want to encourage you there. If you have one physical challenge or the other, please, you are not in it alone, and it cannot limit you from achieving what God has destined for you. But when you are dormant, you may lose out.
Wow.
Yeah.
You shouldn't lose out. Take care of your mental health, whether you are living with disability or not. It's very, very important as your physical health.
Sure.
Madam, thank you, nurse, for educating us today.
Yeah, it's my pleasure. Thank you.
Thank you for listening to us today, watching and hearing us today. I know that you're going to do what she has taught us today. Remember, let's have a good and productive week and remain positive in life. I'm Angela Ekore.